Alrighty. Well, good morning, everyone, and happy Thursday. Happy finally Friday Eve. Hope everyone is staying cool this week. Thank you so much for joining us for our June Community Care Coordination team. We had a quick icebreaker for you all this morning. If you'd like to introduce yourself with your name, your organization, and a summer activity you were looking forward to. So I don't know, is there anyone else who didn't get to introduce themselves in the chat that wants to come off of mute?
Yes, my name is Denise Robinson, the Executive Assistant to Community Engagement and Consultation Group. Um, for my summer activity, not sure yet. Trying to make some plans. It's vacation time. It's time to R&R. Hello, everybody.
Morning, Denise. Good to see you. How are things going over at CECG? Are you guys, I know you had a lot of summer activities going on.
Oh, yes. They have a lot of outreach events, especially this month and in the coming months. But everything's going well. Everything's going well. I'm in the office all the time. The paperwork, the shuffling, and the numbers, and getting stuff ready for submission for grants and stuff like that for Miss Anita, Dr. Anita. But everything's going well.
Any events happening this month that you could tell us about?
They had several events that they had, like outreach for library, trying to apply, get individuals to apply for SNAP, Medicaid. Um, oh, they had a lot of. It's all on the calendar. It's a lot of events that they had this month.
I'm curious with what's happening at the federal level in terms of Medicaid cuts. How has that been for your organization and for others on the call? Is that something that folks are tracking? Is anyone having any initial reactions? Did anyone get to attend the county council, the Board of Health? They had a town hall meeting last week about the state of Medicaid and healthcare.
I know for here, we're steadily having potential clients coming in and apply for SNAP. A lot of information I've been reading in my emails. I know they're talking about a lot of cups and snaps as well. We haven't seen anything or heard anything yet, but we do have clients coming in applying and being approved for SNAP and Medicaid.
Great. Glad to see that that is still in motion. And certainly, as folks are starting to see things or, have any questions or any immediate reactions, let us know. Happy to take feedback to the health department and see how we can, best support our partners in these changing times. But we will certainly continue to use this meeting space in particular to talk about these challenges. We'll also do a debrief of some of the policies that we saw that passed or didn't pass this legislative season. We know that with everything going on, it's changing a lot at the federal level, of course, but then also at the state and county level. So we want to make sure that we are continuing to have space for those conversations and to talk to you all about what you were seeing on the front lines and how it's impacting Prince George's County residents. So continue to let us know if there's anything that you all are tracking or would like to know a little bit more about, and we can certainly hold that time in these meetings moving forward.
Okay.
Anyone else want to introduce or offer up any comments about their organization? Alrighty, well, for our meeting agenda today, we have a presentation from our mobile integrated health team. So they are situated with our fire and EMS department here in Prince George's County. So we're going to go over a little bit about their referral process. Here, with the CCCT, you all are very familiar with this, but we have worked closely with, several of our county agencies, some of our nonprofit partners to better understand what care coordinating services look like in the county. So any organization who is facilitating a referral or warm handoff, we want to know how are they going about that? How can we help streamline that process? So that effort is continued this month in this meeting. We want to hear from our mobile integrated health team team to hear a little bit about the services that they offer, how you all can access those services if need be when working with the community, but then also how can we help to streamline their care coordination process, because if anyone is in need of any resources to address their social determinants of health needs, how can we take what we have developed as a CCCT and what we know to be true in Prince George's County in terms of care coordination, how can we then take that and help to inform those efforts? So they will be joining us very shortly. As you can imagine, they're very busy out and about doing what they do best. So they'll be on in just a few minutes. And then we'll do some Q&A. So if anyone has any questions about how to access those resources or how your organization can partner beyond this call, please do feel free to ask those questions. We'll move into our community announcements and then we will wrap up for the day. So while we actually wait for those folks to join us, I'm going to go a little out of order. So we're going to go ahead and start with our community announcements first, just in the event that we don't have time to wrap up with these at the end. So first, from our friends, a few folks from Parks and Rec, and Bright Point Wellness and Hope House, they are hosting an event this Saturday, taking place from 8 a.m. to 12 p.m., dedicated to men's health. So if anyone is interested in attending this is going to be at the Bright Point Wellness Center. And you can scan this QR code to find out more information. And I'll also make sure that this flyer is included in our meeting notes. Next, any nonprofit who is interested, the Prince George's County Council has announced and opened their fiscal year 26 non-departmental grants program. So their grants program is now taking letters of request. So what you will need to do by Thursday, July 3rd, so key in this date, by next week, you will need to submit a letter of consideration. And there are very specific parameters that they're looking for with this letter of consideration. So no more than 2 pages in length, and they want it organized a specific way. So you can see some of those bullets here, but then also this QR code, if anyone wants to scan it real quick, this will also take you to more information, and I'll be sure to get this flyer out to everyone, but it will have more information about eligibility criteria. Again, you have to be a 501c3 to be eligible for this opportunity, and there are specific parameters to submit that letter. So make sure that you don't get disqualified just because you, for example, had too many lines or have had too many words or all that good stuff. So again, anyone who is interested, please share this with your networks for this county council grant opportunity. Next, from some folks over at the Maryland Commission on Public Health, there is a request from feedback. So our health officer, Dr. Levy, he sits on one of the work groups over at the Maryland Commission for Public Health. They have, I believe, about 4 or 5 work groups that have all submitted recommendations for different definitions and how they're measuring different things. And so they want to ask for community feedback. So if you scan this QR code, again, I'll be sure to send this out in our meeting notes, but they're asking for community feedback about their recommendations that each of the work groups has developed. So if anyone is interested in this, it will close next, I believe that's next Wednesday, July 9th, or the following week. And then lastly, from our partners over at the American Diversity Group, this is a really great nonprofit organization. They technically sit in Montgomery County, but we recently toured the space, and they are actually 1 street light from Prince George's County. So you hit the county bounds and you go 1 street light and you are at the American Diversity Group. So we wanted to be sure to share out their resources as well. They have a free health clinic It takes place every Saturday and every Sunday from 9 a.m. to 3 p.m. on Saturday and then 9 a.m. to 2 p.m. on Sundays. So you can go in and folks can receive free blood pressure screenings, different preventative care, chronic disease management, health education. It's open to all. You don't have to be a Prince George's County resident. You can reside in Montgomery County, or you could be a DC resident, for example. And then it's also available to anyone, regardless of insurance or immigration status. So please share this with your networks, anyone who is interested. American Diversity Group, they're also great because they also have a van to be able to transport patients. So if that is something that for example, with the community that you work with, please feel free to give them a call at this phone number below or give them an email explaining your situation, and they can certainly connect you with those resources. Alrighty, and I see Lieutenant is on with us. Hi, China. Good morning. Can you hear us okay? And we are unable to hear you. You're on mute.
Here it goes.
Okay, can you hear us okay?
Now we can.
Okay, beautiful. Well, thank you so much for joining us this morning. So as I mentioned, everyone, we are joined today by our Mobile Integrated Health Team. So the Mobile Integrated Health Team is headed by Lieutenant China Pinkney, who is joining us, firefighter paramedic Timothy Easterling, firefighter paramedic Robert Herbert, and the licensed social worker Tiffany Holmes. Their mission is to improve the quality and accessibility of healthcare to the citizens of Prince George's County through efficient, innovative, and integrated multi-agency means. So thank you so much for joining us. We are so excited to hear more about your services, how folks can go about accessing those, but then to also get to talk about care coordination with you all and how the CCCT can help you all. So thank you again for joining us. And is there anything that you all want to share on your end from your screen?
No, we're good.
Okay, sounds great. Well, feel free to go ahead and take it away.
Good morning, everybody. I was going to start a presentation, MIH presentation. Lieutenant Ping, you want to let them?
You want to share the screen?
You want to share the
Can
screen?
we share our screen?
Yes, you can.
Okay.
So I'm just going to go over some slides.
Share the screen
I'm
first. I
just
gotta
gonna
figure
talk
out.
first. I'm gonna share some slides with you. I'm not going to PowerPoint you to death, okay? Just going to go over some slides, some basic information for the our program. We're a small team, but we got a big heart, so we really work hard for our clients. Y'all have any questions with any screen, let me know, and I explain or try to explain some of the stuff that's on the screen. This is my first time, so thank y'all.
I have to figure out how to share the screen.
So if you look in the right-hand corner next to that big red leave button, there's a share button. And if you click that, and then if you click on your window, you should see your slides.
Can you see the screen?
Yes, ma'am, we can.
Can y'all see it?
We can.
They can see it. Okay, so the first screen is shown what they, yes. Okay, LT. So the first screen is when the program was started. We started back in 2016, and our first home visit was November 14th. I came in a little after that. So our mission is to improve the quality and accessibility of healthcare to the citizens of Prince George's County So a lot of it, we go out and we help our elderly community who's unable to get to the hospitals, who can't get medication, who family member unable to help them out. Sometimes they need food. So we go out and we try to, show them that we here for them if they don't have anybody to help them, okay? This screen right here tells about mobile integrated health. It's cost effective. We don't charge anybody. We use the insurance company if they buy stuff for them, or we use grant money, get them food. We have a grant called we got a grant from Kaiser, so we use that grant. We got somebody new furnace this year. We got somebody some steps. We get them food for mom's meals, 14 meals. So everything we do is cost effective. We don't try to charge the residents anything. They don't have to worry about giving us their credit card. We might help them pay their bills if they have the money for it. Set them up for auto pay because sometimes our generation forgets to pay their bills and their electric might get cut off. So I would come over, hey, Miss Johnson, what's going on? Well, my electric off, but let me help you out. Let's see what's the bill. Can I put you on the payment plan? So I call and advocate for them, let them know, hey, Miss Johnson just forgot to pay this month. She don't got all the money. How can y'all help her out? So that's our we don't try to charge them anything. We don't charge them anything at all. If the insurance company can't do it, we'll try to find other programs to do it.
I'm just going to interrupt really quick. If you are advancing your slides, we are still on the first slide.
Yeah, you are?
Yes. It may just be on my end. Are folks still seeing the open slide that just says MIH?
Can y'all see it? Y'all
All
see
we
it
see
now?
is the open slide. No.
No, we're still seeing your first slide there. You may want to share your screen instead of the window, and that may
Share.
follow you in real time.
So go back to the other one that she did.
Yes, so if you go back
It's
to
a-
that share button, it should give you two options, a screen and a window. If you want to try your screen, maybe that will follow you more so in real time than your window.
Okay. Let's go to that screen. It says share screen. Yeah, I think she hit that one. Y'all see it now?
Yes,
It
if you
says-
can pop it in a sharing mode and play from the current slide, and that should put you in PowerPoint version in presentation mode.
From the current slide.
Yes, sir.
Okay. From current slide. Can y'all see it now?
It is just taking a second to load on our end. Do you want to, can you click from current slide one more time?
Say it again.
Could you click from current slide one more time?
From current slide one more time. So say you are sharing your screen. I do see that up there.
Okay. We could just go through it just like this. If you could just scroll, click through the slides, and we should be able to move with you.
Okay. Can you see that?
Yes, we can.
Great. Okay, that was the cost effect of the cost one. Let's go down. So this the MIA structure. Can y'all see that one right there with System 5 Chief Buskin? So
Yes, we
these
can.
are the people that just ended the program. Like I said, we small, but we got a big heart, so we work pretty hard. And this is lieutenant responsibility. So lieutenant, she gets the referrals. She monitors day-to-day activities. She collect data for us. So like people need data. How many people fall? The clients you have. How many people need food? Do all your clients have insurance? So she keeps all the data, all the numbers that we need. So that people say, hey, well, we're going to help you, but how many of your clients have Kaiser insurance? So she collects all the data from where our clients mainly at. If they're in this area, more clients in this area. So she's our data collector right now. We're in the process of trying to get a data collector. She Monday they did make sure we're doing home visits. How many home visits we have a day? Maybe 4 home visits a day. We try to do per coordinator. So that's lieutenant responsibilities. And you can read the screen. She have a lot more to do. She do a lot more things for the program, more administrative things. She do have clients. So she also helps out if we get overwhelmed. We got too many clients. So our social, can y'all see the social worker? So our social worker, she do the brief assessment. So she call all our clients. Anytime we get a referral, social worker call, she get She also able to know they have mental health issues. She know how to get them into certain programs that can benefit them. If they have any type of issues that we can't catch, our social worker is pretty good. She helps out with developing plans. I'm sorry, developing plans for the clients. We work together with her. If there's a client that we can't find certain things, she know how to get everything for us. And she also calls the PCPs of all our clients. So she calls every doctor. A PCP is a doctor. She called every doctor for our clients, let them know, hey, they're with the program. This our consent form. We go appointments with them. So they need ride to appointments. They can't get Metro access or anything. We don't let them miss appointments. So we take them to appointments. We take them to get food sometimes to. So she makes sure that the doctors know, hey, you might see extra person with them, they're with our program. She do a lot more things, but she's unable to be here to let her know what she do. She had a meeting to go to, but probably later time she can explain in detail what she do. This the MIH coordinators. That's me and Rob. So we go out every day. We do home assessments. We make sure that their home is safe. We make sure they have smoke detectors working. We make sure their stoves work. A lot of our clients' stoves be malfunctional, broke, or sometimes the burners be on and it be gas smell in the house. So we make sure we do a full assessment of the home. We make sure the home is clean. They don't have trip hazards. A lot of them have clothes or other things around. So we do everything. We try to find them programs to get their house clean if it's really in I wouldn't say a mess, but in disarray. We try to find them companies to help clean it up or family members to clean it up. We also check their refrigerator, make sure they have food. Sometimes a lot of them don't have food. The food be old, the food be spoiled. We try to clean the refrigerator for them. If they need assistance, we have a company now we're dealing with that can assist them to give them a nurse for maybe 4 to 8 hours a day, 4 days a week. They will help clean them up, wash them up. They're also taking the doctor's appointments, and that company, we just started with them. They have one client right now, but they have to pay out their own pocket. And it's pretty expensive for somebody who's on a budget. So, but them the ones who can afford to get the home health care aid to come for 4 to 8 hours a day. Also, me and Rob make sure the clients are taking their medication, get a current medications from their PCPs. So we say, hey, we'll go to your doctor. Can you give us the current medication? Once we get that, we'll put their medications in a medication toggle box. So they won't misplace the meds. They don't double dose or anything like that. So we'll do that too. Make sure that they take their medications, because a lot of them just forgets to take the medication or think they did it and might take it twice. And a lot of them, they live by themselves, so they have no help. We also, if the ones who want to get out, we try to find them activities. So we call certain places, hey, you have any activity for senior citizens? Because Miss John's been in the house every day for 7 days a week, and that's not good for her. So we try to anything they need for their mental health. Sometimes they be depressed, so we try to get them out around people their age so they can have somebody to talk to, because they'll call us all day just to have a conversation because they lonely. And we pick up the phone no matter what, 24/7 a day. We pick up the phone for them because they need us at that time. We also sometimes we try to get them rides to church. That's a big thing for them. So we're working with Metro Access right now to see if they can get them on Sundays, because Metro Access don't want to. They have their own rules about Sundays. So we're trying to get them maybe go to church service. So we do a lot for them because they by themselves. They don't have the help or assistance. Any questions about what the lieutenant and the social worker and me and Rob do?
I am just curious. So can you talk to us about how folks make contact with you all? Is this through 911, or when you say like they call you directly, do you all have a direct line that folks can call?
That's a wonderful question. I should have told you. So we have referrals. So our firefighters in the fire department, they go out. So that's the way they do referrals on our EPCR. If they say, hey, I went over Ms. Johnson house and she need help. So we have a button on our EPCRs, and they can start typing information in about what's going on with the clients. And as soon as they push submit, it goes right to the lieutenant, and she pulls every referral for everybody that we have, and we also go out. And that's how we get a lot of our clients, through our own people going out and visiting people. And sometimes if people call 10 times a day or a week, we have those people, high utilizers, and they say, hey, we ran this person 6 times this week. And we gotta say, well, what's going on? So we go out and talk to them like, oh, because of this, oh, because so that's how we get a lot of our clients. Also, we work with doctors, hospitals. A lot of hospitals do referrals too. So if you go, even though let's say they don't call 911, they just go right to the hospital. And so they just send a referral out that way through this. Then they have like a referral form that they email to us, and the lieutenant take those referrals and put on the iDrive, and we just go out and see them. So majority of our calls again are through our EMS system, seeing people every day, and we get them from the hospital too.
Thank you for that. And I see through our county page that there's also a way that you can just visit online and be able to submit an e-referral. Does that all just kind of go into like the same system that you all are managing?
Yes.
Okay.
So anybody can go online. You can self-referral yourself too.
Mhm.
So anybody can go online and can do, they can call up to our ops center, and they will do a referral that way for them too. So if anybody need help, they can call, their family can call. Even when let's say we go to somebody's house and we see his patient wife, and husband said, well, I want to be in a program too. Then you're in the program too. If you need help, we're there for you. So if you can self-referral, or you can get referral from the field or the hospitals.
Thank you for that. And folks, for everyone on the call, I did put the link in the chat, and you can go and visit that direct referral link that we were discussing there. Any other questions at this point in the presentation? Ms. Denise?
Yes, good afternoon, sir. This is some good information. Is this only for seniors or those that's in need of these services?
18 or over. Anybody from 18 or over. And if you do have kids, we will help you with kids too. So we have clients that have kids that need school supplies. Because you're part of the program, we'll find you school supplies for your kids too, and get food for you and your kids. So, but you have to be 18 or over to be in part of the program. And a resident of Maryland, Prince
Okay.
George's.
Prince George County, right? Thank you. Okay, thank you.
No problem.
Dr. Cooper?
Yeah, good morning. Once again, this is wonderful information. As you know, many of the hospital emergency departments, after discharging patients, there's not a warm handoff. And my question for you, you offer transportation services, and we're looking for continuity and coordination of care. So would it behoove us to have you hospitals call your department directly when they're ready to discharge individuals so that we can maintain this continuity and coordination of care? What do you recommend?
Okay, so when you discharge, they have to have a referral in place and be part of the program. So if the patient or client is one of our clients, yes, we can get an email, let us know, hey, that Ms. Johnson went to the hospital again, which would be great for us. Because a lot of times we search the CAD system, see what our clients is at when we can't catch up with them. But yes, if they part of the program, y'all can give us an email. We'll try to meet them at the hospital when they get discharged, or meet them at their house and see why they went to the hospital. But for any new clients, you have to do a whole new referral process. They have to sign the consent form to be part of the program. But yes, we do work with hospitals about our clients once they get discharged.
Wonderful. Thank you so much.
You're welcome.
Oh, I'm sorry. I should raise my hand. In that, if it's a patient that's not on your program and they've been discharged, who do they go to in the emergency room, or where in the hospital? And do most of these hospitals know this information?
So yes, majority it'd be the social worker of the hospital who send a referral to us. they'll say, hey, this client right here, somebody will benefit from your program, and they will send a referral to us, and we'll go to their house and have a meeting with them. Majority of the time, it's always the social workers, and it's not really anybody else, no nurses or doctors that refer the program to us. It's mostly the social workers of the hospital.
Okay, great. Thanks.
And I'm curious, how do you all keep track of the programs that you refer your clients to? So, if you identify that Miss So and so needs food, like how do you all keep up? And is that something that you all need help with, identifying new sources to be able to refer patients to or clients to?
Yeah, so a lot of our programs we have on our spreadsheets that we have numbers and contact numbers to work with. Some programs might lose funding. So they're like, hey, well, we can't use them anymore, but we have this program. So we usually know every client and what program they're using, because majority of the time they need food, we might have to pick the food up for them. But we might have to do something for them. So the majority of the time, we know who our clients or what programs they're using or utilizing.
Mhm.
And for new programs, our lieutenant, that's her job. She looks for new programs. That's been part of her responsibility. She looked for new grant money. She called around, she found programs. She said, hey, well, this program you might can use for home health care nurses. So that's one of her responsibility to find us programs that we can utilize for our clients.
Certainly, we know that you all are small but mighty, but need more. And when we talk about expansion, that also comes more critical investment that's needed. And
Yes, ma'am.
Yeah.
This work group in particular, we've taken a look at community resource inventories like Find Help and Maryland 211 that does the heavy lifting for us and goes through and manages those any resources to address the social determinants of health, and they keep up with them on an ongoing basis. So they're the ones to be able to call and ask, is this service, still applicable? Or are you still, or has it ended? So would certainly, be more than willing to connect with your social worker offline to talk to her a little bit more about those programs as well that we use.
That'd be great. Anything will help. We will definitely accept the help. So these are on the initial intake interview, we ask our clients about insurance, if they have, don't have. If they don't have insurance, we do the application for them.
Oh,
We
wow.
don't get to jump in line in front of anybody. We don't have that
Right.
contact yet. Our fire chief is in the process of trying to get us to not to have to wait like everybody else. So they don't have insurance, which I apply insurance for them. If they don't have benefits, TANF, they might need food stamps. We also assist with that application. We have computers that we can take to their house, type them up right there for them. It also say child care. I haven't done that yet, but if they need child care help, I will find it for them. Any medical issues, not taking their medications, why they chest hurting. So we have everything we equip when we go to their house. I have my own monitor. I have my red bag, which have all my medications in. I check their blood glucose when I get there. I check their blood pressures. Every visit, I do a full assessment of them when I go to their house. So I'm a paramedic. I go there. I say, hey, how you feeling? Well, let me check your blood pressure. Oh, your blood pressure pretty high. You get to take blood pressure medication today? I think I did. Well, let's make sure. And so I'll go look at the toggle box and I'm like, well, you missed it. And so our job is to make sure they're healthy. If they don't have a doctor, because a lot of them just don't, they have their insurance, but don't have a doctor. So we call around. Some insurance places, I don't have to even ask them for their referral doctor list. I just can pull any doctor up. Also financial, I got to find out how much money they make. Because a lot of programs say, hey, if you make more than this much money, I can't help you. So I gotta know how much money they make, if they make enough money to pay their rent, if they getting Social Security, retirement. If that matters a lot, because a lot of programs not gonna help you make too much money. Again, I said food, housing. I have not done employment yet, but we will help you find a job. But majority of our people really on retirement and they done with working. No part-time jobs. So that's the things we do in initial intake. And also initial intake, we look at their whole house. Upstairs, downstairs. If they're missing smoke detectors, I can put smoke detectors in their house. If they got the old smoke detectors, I put new ones in there. You have to have 10-year smoke detectors now. So there's no more smoke detectors you could take batteries out of. Those old. We don't use those anymore. So I got a lot of them still got the old smoke detectors. I put new ones up there. Every floor near every sleeping area and definitely in the kitchen. Some people need CO detectors. They don't have any. So I gotta go to logistics, get CO detectors and place those because we want them to be safe. So a lot we do, we try to look out for them, make sure that they're healthy and safe. Can y'all see this one right here? Now this is the big one. Can y'all see the screen? So these are our risk stratifications. So this let us know how many times we gotta see our clients, if they low or they very high. The high ones are the ones who call frequently, maybe like 3 times a week, 2 times a week. Those are ones we call our high flyers. They call a lot. And sometimes it's not because they need 911, it's because they're used to calling. So I got to try to not break the habit, but give them another outlet if something is going on, like because your leg is hurting, doesn't mean you got to call 911. I have a client and she loves calling 911. And of course the hospital get frustrated and the the EMTs get frustrated. So I get a lot of phone calls about clients who keep calling. We try to give them everything they need to not call 911 or not to go to the hospital, because every time you go to the hospital, I guess that's money and there's money getting there and everything. So we try to prevent that. So that the high people we see, as you can see, we have to see them a certain amount of times a week. So this is low. Our low people are the ones who just call once in a blue moon but need help. Our medium, they call maybe, it says right here, any time in any remission in 30 days. That means that you was in the hospital and you back within 30 days. Them the ones the hospital say, well, they don't get, from my understanding, they don't get paid, they come back in 30 days. That's what I was told. So that they don't want the ones that keep coming back within 30 days. They can't charge their insurance company. Sometimes they just don't know you can use urgent care. Like I can try to say, hey, you want to go to urgent care today for your leg, or you want to go to the hospital? Which way you can get seen quicker. Our high utilizer, sometimes it might be a mental thing going on with them. So I get our social worker involved. And she do her own assessment, the social worker assessment. I wish she was here, she could explain what she do for a high utilizer, but she take care of that herself. Any questions about low, medium, or high utilizers? Everybody good? Okay. So this right here, let us know how many times we have to see our high, medium, and low. So for our high, I have to see them face to face once a week for the first month. So they might have to see them at least 4 times out the month. Is way more than that. Because I might see them on Monday and they go to the hospital on Wednesday. So I got to go back on that Thursday and see what happened, why you went to the hospital, and see what we can do to make sure you're getting your medication. When they gave you a new prescription, I got to make sure they got prescription filled. So our medium, I see them face to face 1 times a week, a minimum of 1 call per week. So that means that I have to see them face to face, but it might be more than once a week with medium too, because they almost to the high level. So I'm trying to prevent them from being a high caller. So what's going on with you, Miss Johnson? Why you keep calling? Well, my leg's still swollen. But you take the medication? No. Or I couldn't get the medication. I go pick it up from CVS for her so that she can get her medication. I got to find out where to send it at first. And then I pick it up. Well, you got to use it for a week or so before the swelling go down. I read directions to her and everything, just so they know that, they have help. Our low, we don't really have to see them a whole lot. We call them, and we also always check on them, because sometimes on the phone they say everything is good. I'm fine, but you go to the house and the house in disarray. There's no food in the refrigerator. So I will call our food bank or food pantry and get them a whole grocery list of food so they can maybe have some food to eat. If they can cook on the stove. So you also gotta know if they got cooking issues, we might just go and get them food sent to their house through mom's meals. So we always, no matter what, we check on our clients more than once a week. So this is our whole goal is to get them to graduate. Our whole goal is to get them not to stop calling 911, to be somebody want to come in. We want them to just be able to take care of themselves. So once all the goals we hit for them, got them all they, also we get medical equipment for them too. If they need new beds, medical beds, they might need new wheelchairs. They might need anything. Durable equipment, we love using. We get new beds, hospital beds. We get Hoyer's lift. We get wheelchairs from them. We get everything from them. And they really, really, they give it to us in a great time. We put application in. Within a week, we get the equipment we ask for our clients. So every goal we hit for them, and they doing well, they're not calling 911, they not missing doctor's appointments, then we graduate them. Once we graduate them, which is, we do get to graduate them, we still watch them. If they call 911 again, we still check the cash system, make sure they're not calling 911. I still give them a call, make sure they're not missing doctor's appointments. But once they graduated, then we let them go. We try to keep touch with them, make sure they talk to their family members, and that's it for them. And this is the data, and this is like all the areas that we have. As you can see, can y'all see all the areas where our clients is at? The county want to know where a lot of our clients live at. Also, we have more clients now. We have more than 40 clients. This is maybe like a month or so, but the client list, it goes up, it goes down. Once they graduate, we discharge them. So these are the numbers of all the people that we had in our client at that time, the early lived in. The lieutenant keeps all the data and keeps the data so people can know, hey, majority of clients live in this area. That's the age and how long the people been involved, in our program. We try to get them out within 4 months. We try to get a client within 4 months, let them meet their goals till we graduate them. Sometimes it's longer. I think our client, maybe 2 years they've been in the part of the program. But that's because when we want to discharge her, she started by calling 911 again. And somebody putting a referral on her. Let's say we about to graduate, like, she doing well. Next you know, I get a phone call, or we set her name up on the referral list again. She went to the hospital, or she got referred again. Then I gotta go see, well, we just about to graduate you. Then we start over again. So we try to get them, like we really want them to say, hey, I can do this on my own. And this is our goals. Data analysts, hoarding programs. We're working on that right now. We have a lot of clients living in hoarding conditions. We're trying to find a program that can clean up houses. That's our next thing. We are getting new grants. We was almost had a nurse practitioner too. COVID hit. We was close. We got to try that again. We are on the process of trying to get a fall and lift assist program. Our assistant chief is in the program, trying to get us 24-hour service so we can be at nighttime. Because right now we 7 to 3, Monday through Fridays. So the weekends where people call the most, right? The weekends where people fall the most. Over the weekend where people don't have any help. So he trying to get a program where we can be also on weekends to assist the clients. We definitely need home healthcare nurses, aides. A lot of these problems could be alleviated if we had more home healthcare aides and home modification programs for people who need to get up and down the steps. They need new bathrooms, handicap accessible bathrooms. We're trying to find money to assist with that. We'll get grants to help people with getting new steps, new furnaces, and everything like that. So that is it. If anybody have any questions, please throw them at me.
Thank you so much. Miss Denise, I saw your hand earlier. Do you want to go first? Do you still have your question?
Yes, I know this is a challenge in all counties, and it's the homelessness. And there's a lot of them that I know to go to hospitals and have nowhere to go. So, what's your take and what's your thoughts? And not only in seeing these numbers and what you all do, Prince George's County is wide. So, how many is your staff is helping you along the way with all of this?
Okay. Per the state of Maryland, we're supposed to have only 20 clients to one coordinator. We doing way more than that. We are in the process of getting more paramedics into the program, but because of the summer staffing plan we're going through right now, it's kind of being held up. Our assistant chief know we need more paramedics, but we gotta get through the summer first because you get more vacations, more call outs. So we're in the process of trying to get more paramedics, but we only supposed to have 20 to 1 per Maryland. But sometimes, again, 21 is for, let's say we have all high. We don't have all high. So I can maybe get 30 to 35 clients by myself, and I'm going to really focus on the high utilizer. And my low, I will get more phone calls, maybe once a week, like I said. But it matter, you're not going to have 30 high utilizers. So, you can work that. And with the homeless, we are talking to Mr. Summerlot. I think Summerlot is the homeless coordinator. And we had a meeting with them, and they're in the process of trying to find a way with the homeless. We do have a homeless client. It's kind of hard to catch up with them or call them or anything because they move. So we really get the help out the homeless, but we do have clients who become homeless, and we'll call the shelter for them or try to get them into the shelter or contact the summer lot and their staff. But mainly, the lieutenant will handle the homeless ones because she have a better relationship with the homeless program. And what was your other question, Miss Denise? The homeless
I,
and
yeah, I think you answered both of them as far as your
okay.
staffing. Thank you so much.
And Jay is actually on the call. They're with us today, part of our
I-
CCCT.
Hey, how
Yes.
are you?
Oh, there you go. Mr.
How you
Summerlin,
doing?
there you go. Yes. So yes, her and him and Lieutenant is dealing with that.
And a question that you had here in the chat from Judy, do you know if you have access to CRISP? It's the Health Information Exchange for Maryland.
Yes, ma'am. We have Chris. Yeah, all our clients is placing Chris. It works wonderful to go read. While they went to the hospital. So we do use Chris a lot. We can't get in touch with our clients. Let's say I had a client couldn't find for a while, and I went on Chris when I found where Mr. Wallace was at and what happened to him, and I was able to catch up with him. That program is great. I love Chris.
Excellent. Any other questions?
Woo, I made it.
I see you got one more from Wendy here.
Did she say
Sorry,
anything?
I couldn't get my mic off. Um, are you fully grant funded, or do you get funding from the state or the county, or?
Um, that's maybe be over my pay grade. I'm not sure. I don't. We don't get any funding from the county, but a lot of our money that we get is from that we can use on our class is from grants. It's from Kaiser, or we can use other programs to assist us. So we don't get any funding for the program, from my understanding. I could be wrong. Again, I don't know, but we don't get any funding but from grants or we use other programs.
You guys, this is just the best thing since sliced bread. Thank you for sharing.
No problem. We love our clients. We love because a lot of people just need help. They just need somebody to be there for them, to steer them the right way. Sometimes they're just lonely, an ear to listen to. So there's a lot that we can do. Just you don't need money to give time and caring about people.
And I'll ask one last question and I'll let you go, Tim. But I'm
No
curious, so we talked a little bit about 911, but also with 988. Have you all integrated in with the 988 calls that may be received and any of those referrals coming from 988?
Yes, we was. We were using them. We had a meeting with them this year, and they are in the process of getting new programs, from my understanding. And Lieutenant and them going to have more discussion on how we can help each other out. But we did use 988 to try to help out and see for the ones that we could assist with and we can help out with. But they're in the process of getting more money, more grants, and we should be working with them pretty soon.
Wonderful. Well, thank you so much. You've got so many congratulatory messages here in the chat. Thank you so much for taking time out of your busy schedule. And thank you for your commitment to protect and serve all of Prince George's County residents. We couldn't do it without you all, and appreciate your very small but very, very mighty team. And if you ever need anything from this work group, you've got several nonprofit partners on the phone of several folks from different county agencies. So we are all here to support you, offer up any resources that we can, keep you informed of any grant opportunities, because as many have said, that this is something that needs to be sustained.
Yes, ma'am. Thank y'all so much for your time. And I will let Lieutenant know about what you just said.
Absolutely.
Yeah,
Thank you so much.
Have a blessed day, everybody.
Thank you. You as well. All righty. Well, thank you everyone so much for all of your questions. If folks, I will ask Tim to share over the slides, but if anyone has any additional questions or reactions, feel free to send them my way, and I'll put together an email and reach out to the Mobile Integrated Health team. So we're going to go ahead and close out since we did our community announcements to begin. But did anyone have any announcements or any events that they wanted to share? All righty. Well, just a heads up, our July CCCT meeting is going to be canceled to give everyone a wonderful summer break. So stay cool, stay safe out there. Also, a personal note from me, this is going to be my last CCCT meeting. I am transitioning from managing the coalition. So this will be my last month with you all, but I will, of course, still be around to answer any questions or make any connections, and certainly hopes to stay connected to this team. So I'll still be with the health department over in the health and wellness division with our diabetes team. So my email is staying the same. So if anyone needs anything, do not hesitate to reach out. I am happy to get you all connected. But thank you all so much for your service. I know that you volunteer your time on a monthly basis, but I know you all have such fabulous full-time jobs that you go and you do outside of these calls. And I really appreciate all that you do for Prince George's County. So thank you all so much for all of your efforts. It's been such a pleasure working with you all. And do not hesitate to let us know if you all need anything during the summer. Otherwise, we will reconvene in August.
Okay, you take care. Thank you. Congratulations.
Thanks,
you,
Taylor.
everyone.
Thanks, everyone.
Thanks, Jay. Have a good one.